We had an opportunity to purchase some property that already had a plan that had already gone through the City of Lebanon planning process. And so we saw that as an opportunity at a relatively low cost to purchase additional facility capacity. Then when we had that property, we recognized we had several objectives that it could accomplish. First of all, it was an opportunity to relocate family medicine, which is currently in leased space. It's been in the same leased space for 20 years, really needs better, more appropriate space for their services. Secondly, it gave us an opportunity to increase our overall outpatient resources, and particularly when we think about where healthcare reform might be going, the need for more primary care, preventive care, this was a project that enabled us to build some of that capacity into our system. The third major objective is that we actually need more space here at the main campus for inpatient beds. The only way we can create more beds here is if we can relocate some of our functions from this campus to the Heater Road campus. So it really hit three sweet spots in terms of objectives we needed from a space and facilities perspective. We are running at 90 to 100% occupancy on a regular basis, and the area that we're particularly tight is critical care. And so as more and more community hospitals see the need to send tertiary patients here, trauma patients, et cetera, we really need that critical care, intensive care capacity. We just don't have enough space for that today. So an example is that some of the services we're moving include outpatient rehabilitation. That currently exists on level 3 of the main campus right off the mall, immediately below our current critical care units. By moving them off-site and some of them into another space on-site, we can actually create a new critical care unit that mimics the critical care unit upstairs. So it's a nice footprint for accommodating the kind of patient care for critical care patients. It was an interesting project because we purchased an already partially designed project. So we had a footprint of a building that was approved by the City of Lebanon. It was going to be a medical office building, so a developer was thinking about it in terms of leasing suites to a variety of clinical practices in the Upper Valley. We couldn't be as creative as start from scratch as we might ordinarily. So one of the challenges of the Heater Road project was taking a fixed footprint and designing the interior to meet our needs. Our architects were particularly innovative, I think, in providing us the footprint that we need to provide especially that primary care, preventive care capacity in that building. The middle floor, the main floor, is all exam rooms, and we've created that space in a very generic way so that as providers change, as clinical practice changes, we can reallocate that space very easily and not have to take down walls. Basically, it'll be changing the names on the doors. The other thing that we did for the Heater Road project is that we thought about the image of Dartmouth-Hitchcock. And so we took exterior elements from the main campus, as well as the exterior elements from our other facilities in Concord, Manchester, and the new Nashua project. And we tried to pick elements of those facilities that were reminiscent of Dartmouth-Hitchcock. And so when people drive up to the facility, they say, ah, I'm at a Dartmouth-Hitchcock facility. I know I'm going to get good care here. So we use some of the white paneling, we use some red brick, we use some of the same exterior coloring, not to replicate because we don't want to confuse people, but enough similarity so that people say, I'm at a place where I can get good care. I might also say that the Heater Road project was a great project because we were able to build at a time when the environment really benefited from our doing new construction. If you think about it, we are building this in a time when other people are choosing not to build, and so we are creating jobs and providing income to the local economy that is really a gift, I think, in the long term. And because of that, partly, we were able to get pretty good pricing on our construction, and so we were able to build this at a fairly economical construction rate as well.